Congress recently passed legislation aimed at improving mental health services for healthcare workers. It was named in honor of Dr. Lorna Breen, a New York ER doctor who took her own life 2 years ago. The importance of mental health well-being is something that Baptist Health has tackled since the beginning of the pandemic. KENS 5 reporter Zach Briggs shares how.
The COVID pandemic has taken a mental toll on healthcare staff across the United States, including right here in San Antonio. Baptist Health has been at the forefront of addressing these challenges, and they have a new program in the works. Baptist Health System's Dr. Tim Cranfill remembers some of the worst days of the pandemic when supplies were low as hospital beds quickly filled up.
They felt very helpless, as did all the nurses and all of us. Very helpless.
Those feelings of helplessness and anxiety can seem overwhelming for those working on the front line.
We have a good idea of when they are in a good place and when they're not.
Baptist Health System now rolling out Code Safety Net, a program based on similar practices of pastoral care to emotionally support staff.
It's also an evidence-based triage assessment form that we utilize that will assist us in helping to evaluate the individuals, whether they're, okay once that initial contact is done and completed, whether they might need follow-up or whether they might need referral.
Their mental well-being will then be monitored for improvement over several weeks. Cranfill's hope for the future post-pandemic begins with breaking down what he says is the biggest barrier for healthcare workers, the stigma of mental health.
But I think as we are able to have more evidence of how it impacts everyone, then there'll be evidence, in someone's personal life that I'm not alone.
And by reducing that stigma, Cranfill believes people in crisis will be more willing to come out and say they need help. Zach Briggs, KENS 5.